Hello everyone, welcome to the series of clinical presentations and diagnosis, part 4. This is Dr. Kavya here. If it is your first time watching this video, please go through my channel and you can find the previous 3 videos according to this series. Without any further delay, let's get into this video. 43. There is a case with tonsillar pseudomembrane with bull's neck appearance in a child. The pseudomembrane over the tonsil is nothing but a white patch. It may be seen in various differential diagnoses such as membranous tonsillitis, diphtheria, Vincent's angina, infectious mononucleosis, agranulocytosis, leukemia, aphthous ulcers, and malignancy tonsil, or it may also be traumatic ulcer. The most important characteristic bull's neck appearance directs our diagnosis towards Corynebacterium diphtheria. Corynebacterium diphtheria are the gram-positive rods which are arranged in an angular arrangement. The infection spreads via respiratory droplets. These Corynebacteria produce exotoxin which is encoded by beta-prophage. It causes diphtheria. It inhibits protein synthesis via ADP ribosylation of elongation factor 2 and causes necrosis especially in pharynx, cardiac tissue and central nervous system tissue. Coming to the clinical features, the patients may have pseudomembranous pharyngitis, lymphadenopathy, which gives the appearance of bull's neck appearance. The person may also have fever, malaise, myocarditis, arrhythmias, and also neuropathies. It is diagnosed by various methods such as elixir precipitation test. It is for identification of toxin by using antitoxin. As you can see in the picture, the Corynebacterium diphtheria is a club-shaped bacteria and it contains Babes-Ernst or Volitin granules, which are also called as metachromatic granules. The Corynebacterium diphtheria are generally called as Klebs Loeffler bacillus because it grows on Loeffler's media. McLeod classified Corynebacterium into 3 types, that is Corynebacterium gravis, Corynebacterium intermedius and Corynebacterium mitis. The gravis colonies look like daisy head colonies and intermedius colonies look like frog eggs colonies and mitis colonies look like poached egg colonies. These are very important to remember. There is a toxoid vaccine available to prevent the occurrence of Corynebacterium diphtheria infections. We can remember the important things about the Corynebacterium diphtheria by remembering it as A, B, C, D, E, F, G. That is, it causes ADP ribosylation. It uses beta-prophage. Corynebacterium diphtheria, it acts on elongation factor 2 and it has granules which are known as metachromatic granules or Babes-Ernst granules or Volitin granules. And the treatment includes diphtheria antitoxin, erythromycin or penicillin. Number 44. The case presents with back pain, fever, night sweats and evening rise of temperature. The most important things that points to a diagnosis of TB spine are having evening rise of temperature and night sweats. Vertebral TB or spine TB is also called as spot spine. It is caused due to Mycobacterium tuberculosis. There are various classes of Mycobacteria. All of these are acid-fast and rods. The Mycobacterium TB causes tuberculosis. Mycobacterium avium intracellular causes infections in AIDS patients. Mycobacterium scrofulicium causes cervical lymphadenitis and Mycobacterium marinum causes hand infection, most commonly in aquatic handlers. 45. The patient presents with adrenal insufficiency, fever and disseminated intravascular coagulation. The diagnosis here would be Waterhouse-Friderichsen syndrome. It is caused as a complication of Meningococcemia. 2 important Neisseria are Neisseria meningococci and Neisseria gonorrheici. The Waterhouse-Friderichsen syndrome is caused due to meningococci. These are gram-negative diplococcal bacteria. They produce IgA proteases and lipo-oligosaccharides which have endotoxin activity. Meningococci have polysaccharide capsules. They have a characteristic feature of maltose acid detection. Type B vaccine is available against meningococci. The meningococci most commonly spreads through respiratory droplets. The meningococci cause meningococcemia and Waterhouse-Friderichsen syndrome. It is nothing but acute hemorrhagic adrenal insufficiency followed by DIC. The diagnosis is done by culture-based test or also through PCR technique. Treatment is mainly rifampicin and ciprofloxacin and ceftriaxone in the contacts. And the patients can be treated with ceftriaxone and penicillin. 46. Red currant jelly sputum in patients with alcohol overuse or diabetes. The red color jelly sputum indicates there is an infection with Klebsiella pneumoniae. The Klebsiella pneumoniae are the gram-negative rods, which are most commonly the intestinal microbiota. They causes lobar pneumonia or healthcare-associated urinary tract infections. The Klebsiella pneumonia are diagnosed based on the mucoid colonies. There will be abundant mucoid colonies on the medium in which they grow because of the polysaccharide capsules they have. The characteristic feature is having the red currant jelly-like sputum. Clinical features can be remembered as ABCDE of Klebsiella. There is aspiration pneumonia, abscess in the lungs and liver, red currant jelly sputum, diabetes mellitus, and ethanol, or that is nothing but the alcohol overuse. 47th. There is a case of dog or cat bite resulting in infection such as cellulitis or osteomyelitis. Whenever you see a dog or cat bite or even the human bite, the most common organism that is responsible will be Pasteurella multicera. It causes cellulitis at the inoculation site most commonly. It is a kind of zoonosis. Zoonosis is nothing but the transmission of infectious diseases from the animals to the human beings. The Pasteurella multicera causes cellulitis and osteomyelitis, as we have already seen in this case. And it spread to dog bites, cat bites, and various other animal bites. Quickly see the other zoonotic bacteria and the diseases caused by these bacteria in an alphabetical order. You can easily remember if we discuss it in an alphabetical order. Firstly, it is anaplasma. It causes anaplasmosis. Bartonella, it is called as it causes cat scratch disease or bacillary angiomatosis. Borrelia burgdorferi causes Lyme disease. Borrelia recurrentis causes relapsing fever. Brucella causes brucellosis. Coxiella burnetii causes Q fever, which is very important topic. Francisella tularensis causes tularensis, which spreads to parrots especially. Leptospira causes leptospirosis. Rickettsia prowazekii causes epidemic typhus, and Rickettsia rickettsii causes Rocky Mountain spotted fever. Rickettsia typhi causes endemic typhus, and Yersinia pestis causes plague. 48. The case presents with atypical walking pneumonia with X-ray that looks more worse than the clinical condition of the patient. Whenever you see the X-ray of the patient is worse, but clinically the patient is good, you have to suspect that it is a case of Mycoplasma pneumonia infection. Typical walking pneumonia presents with the insidious onset, headache, non-productive cough, patchy or diffuse interstitial infiltrate in the X-ray, and macular rash. This organism is pleomorphic, and the bacterial membrane it contains sterols for the stability even though it is pleomorphic. Diagnosis, it can be diagnosed by growing it on ear and agar. The chest X-ray of this patient looks more severe than the presentation. There will be high titer of cold agglutinins in these patients, especially the IgM antibodies. Treatment regimen includes macrolides, doxycycline, or fluoroquinolones. The penicillin is ineffective here because these contains no cell wall. 49th. There is a newborn with chorioretinitis, hydrocephalus, and intracranial calcifications. This is a triad of having congenital toxoplasmosis. Toxoplasma gondii, it is a protozoa. The infection is spread through the cysts in the meat, which is undercooked, or oocysts in the cat feces when the contamination occurs in the food making and processing. It can also cross placenta and thus causes congenital toxoplasmosis. In immunocompetent, it has clinical features such as mononucleosis like symptoms, and in immunocompromised patients, especially in AIDS patient, it may cause brain abscesses, which is seen as ring enhancing lesions. It causes congenital toxoplasmosis when it crosses the placenta, in which there is a triad of chorioretinitis, hydrocephalus, and intracranial calcifications. Can be diagnosed by using serology or biopsy, where you can see the tachyzoid as seen in the picture here, and it can also be done through PCR of the amniotic fluid. The treatment is mainly by using sulfadiazine plus pyrimethamine, or for prophylaxis we can use the trimethoprim and sulfamethoxazole when the CD4 count is less than 100 cells. Number 50. The case presents with fever, chills, headache, myalgia following antibiotic treatment for syphilis. These clinical features altogether come under Jarich Hexamer reaction. It is due to the release of bacterial antigens in response to the treatment. A1. There is an infant with a rash on the palms and soles. The differential diagnosis of having rash on the palms and soles are the infection with Coxsackie A virus, that is hand, foot, and mouth disease. Secondary syphilis or Rocky Mountain spotted fever, which is caused by Rickettsia rickettsii. 52. The case presents with smooth, moist, painless, wart-like white lesions on the genitals. The diagnosis here would be condyloma lata, which is seen in secondary syphilis. The syphilis is caused by Treponema pallidum. It is a spirochete, that is nothing but it's a spiral bacteria. The primary syphilis is a localized disease, and there is a characteristic lesion in the primary syphilis that is known as painless chancre. And in the secondary syphilis, there will be a disseminated disease and the presence of painless smooth wart-like white lesions on the genitals, which we have seen in this case, called as condyloma lata. There will also be maculopapular rash and along with lymphadenopathy. The tertiary syphilis is characterized by gummas, iotitis, neurosyphilis, and also having Argyll-Robertson pupil. The ARP is nothing but the accommodation reflex is present and the light reflex is lost. The congenital syphilis is characterized by having special facial features such as saddle nose, ruggeds, snuffle, and notched teeth, also known as Hutchinson's teeth. They also have mulberry molars, having more number of cusps in their molar teeth, and they have sabotine and short maxilla. The diagnosis of syphilis is based on two types of tests. They are specific test and non-specific antibody tests. VDRL and RPR comes under non-specific test, whereas FDA, ABS, and TPPA comes under specific test. In non-specific antibody test, we use beef cardiolipin. It can also be detected by using dark field microscopy and PCR. The important point here in this syphilis test is that many conditions show false positive results on the VDRL. We have to know them and remember them. Some of the important conditions which give false positive on the VDRL test are pregnancy, viral infection, especially with Epstein-Barr virus and hepatitis, and drugs such as chlorpromazine, procainamide, and lupus and leprosy. 53rd. There is a case with ulcerated genital lesion. Actually, it is useful for getting into the differential diagnosis. If the genital lesion is painful with exudate, it may be called as chancroid, seen due to the infection with Haemophilus ducreyi. And if the lesion is painless and indurated, it is called as chancre. It is seen in primary syphilis, which is caused due to Treponema pallidum. Okay, these are the few clinical presentations for today. And if you don't want to miss this series, please subscribe and ring the bell icon so that you will be notified.